discovered is people aren't so much frustrated by the fact that they tried something and it didn't work, but they're just frustrated because they're giving up hope. They don't have the chance, they're not being given that chance that they can actually make an improvement. If you've been treated and it's been unsuccessful, if you've been scheduled for surgery, which I've already asked in this room and there's not this evening, if you happen to have been diagnosed with a disc hernia, a disc bulge, sciatica, stenosis, arthritis, deterioration, facet arthrosis, spondylolisthesis, or osteoporosis, then there definitely or quite possibly could be help.
In an 8 on your side medical report, what if you could get rid of back pain without drugs or surgery? There is a relatively new procedure now available in the Bay Area. I had a chance to talk to 2 patients who tried everything else, then turned to decompression therapy. Ron Titus is being fitted for a decompression session. NASA made the discovery that weightlessness can repair injured backs. A Clearwater doctor came up with the technology here on Earth. Now, decompression tables are available in the Bay Area. You are harnessed before making your way onto an anti-gravity table. It slowly lowers you into a horizontal position where the negative pressure actually draws back in bulging materials.
I was on the machine about 10 minutes and I got like a runner's high, which is like endorphins kick in and it's like, you get this burst of energy like adrenaline starts pumping through your body. And I was like, wow, this thing may be really working.
It works, according to the American Academy for Pain Management. Studies show there is an 86% success rate for herniated discs and a 97% success rate for bulging discs and degeneration and other back problems. All this without surgery.
New England Journal of Medicine reports 51% of all back surgery is unnecessary. But people sometimes don't know where to go or who to turn to. And this is an alternative to drugs and surgery.
Ron says even with a severely degenerated L5 disc with 5 kids and an active lifestyle, surgery was not an option.
That's the last resort, I think, in anything is to have surgery and, start taking drugs. Especially if there's something, alternative that you can at least try.
Steve Hyatt has a herniated L4 disc and 3 bulging discs. He refused surgery even though at the time it was hard for him to walk. But that's totally changed.
I very seldom drag the left leg anymore. Wake up in the morning and feel like I'm much more stable than I ever have been. So when I jump out of bed, I don't favor one side over the other, and most people do.
Both men have seen dramatic results, and Dr. Liberti says if your treatment is successful, you're cured and should not have to come back for more office visits.
One of the most interesting things that we found is that there are almost 500,000 doctors in the United States that one way or another are dealing with pain or chronic pain, specifically with low back pain. However, of the 5,000 doctors, there's only about 3,000 to 4,000 true decompression tables. As I was looking at this technology and deciding a few years ago whether to bring it into the office or not, one of the things that I found is that there are a lot of doctors claiming that they're doing decompression, and they're really not. They're doing some form of traction. They may even be doing inversion. As I was calling around to find out what other clinics offered, one of the clinics told me they can't do decompression on senior citizens, which is, to some degree, one of our main groups of people that get this treatment. And I asked why, and they told me, well, we can't hang them upside down. And I said, one of the things I understand is decompression is not inversion. We're not going to be hanging anybody upside down. And not all decompression tables are made the same. There are a lot of less quality tables. There's only a handful of very, very high quality tables. One of the ones we offer in our office is called the zero gravity table, and it is definitely one of the more advanced tables to get the results. And it boils down to the table has a lot to do with whether we're going to get results or not. NASA actually found this treatment, and even though astronauts are traditionally one of the healthiest groups of people on our planet, apparently some of them had low back pain, and when they went into space and came back, they found out that they were actually a little bit taller and the back pain had gone away. So what happened was this, is we found ways, without having to ship you into space for a little while, because that's a little on the pricey side, to get treatment with this. And what we've done, hence the zero gravity table, is actually creating a negative gravity inside the disc, a negative pressure inside the disc, And that's where we get some of the results that we do. So what we found is taking some of the information from the space program and applying it here on Earth. So what we found was this, is we can actually increase the size of the disc by providing a decompressive force. One of the most important things to do while someone's on decompression, while they're undergoing the treatment, is to make sure that you stay incredibly hydrated. Every single visit that you come in, we're going to talk with you about it. Kim will remind you every time she takes you off the table that it's important that you drink water. Anne's giggling over here because she knows that as a fact. Because as we're decompressing the disc, something has to be able to go in. If your body's not hydrated, you're not going to heal. And to some degree, we recognize that that can be a bit of a challenge, but it's very, very important that you hydrate your body. Whether you start decompression or not, one of the most important things to do is take your body weight and divide that number by 2. Whatever it is in pounds, divide by 2. That's about how many ounces of water you should be drinking on a day-by-day basis. If you're not been drinking that, then you're actually on a dehydrator. Iced tea, Coca-Cola, and coffee aren't necessarily part of that process.
This represents a disc as it is deteriorating, with the disc bulging at the posterior. In this axial view, looking from the top down, we see disc herniation and pressure severe enough to rupture the outer bands, producing a full-blown herniation with pressure on the root nerve. Now, as a result of decompression, we see the herniated material being drawn back into the disc. As the herniation is being drawn back in, the disc height increases as it is restored. Another look from the top view shows the herniated material being drawn back in and new cells called type 4 collagen attaching themselves to the torn fibers, reconnecting them and making them stronger than before.
Very unique structure inside our body. If anybody's either been an athlete or knows anybody who is an athlete, if they ever get a sprain or a strain, we know that we're going to re-injure that area over and over and over again. Because what happens with let's say your ankle or your knee or almost any other part of your body other than the disc, what ends up happening when those are damaged, they start as type 1 collagen when they're healthy. They become type 2 immediately, but heal as type 3 collagen, which is weaker. Type 3 collagen would be like taking a t-shirt and putting a match to it, and if you were to ever try to pull on a t-shirt, you're never going to rip that shirt, but if it's been burnt a little bit, it rips fairly easily. So that's why people will re-injure. The disc does something very unique. When it heals with what is called type 4 collagen. Type 4 collagen is actually stronger than type 1, so once the discs heal, that disc is going to heal and stay that way. Decompression works because it actually is going to relieve the pressure from the disc to the nerve. The nerve is always the key, but it relieves pressure from disc herniations, disc bulge, sciatica, which is the pain down into the leg, facet syndrome, which is where the joints in the spine are jammed together, even degeneration. Decompression is going to work because it reduces disc herniations, disc bulges. It actually enlarges the space of the disc, and that's been proven multiple times on MRI.